Hi, my name is Brianna Breidenthal.
Hi, Jordan Adams.
I am interviewing for my Kinesiology 303 class. And first, I'd like to ask you 8 questions, and then hopefully get you to ask me 2 questions.
Okay.
So my first question is, what type of training experience would I need for your current position?
For working at CBU?
Sure.
Okay.
Yeah.
So, I'm a physical therapist, so I have a bachelor's degree, and then I went and got my clinical doctorate. That will give you the freedom to work basically in anything physical therapy related.
Okay.
For this position, it's all based on the accreditors for the education, and so there's minimum years of experience.
Okay.
Having 1 additional certificate for clinical instruction, so you can actually teach students.
Okay.
But other than that, that's what the criteria is.
What role does networking play in your career?
It's huge because I set up all the clinicals for students.
Okay.
So I'm constantly out meeting with clinicians, letting them know about our program here at CBU, just making sure that when we send students to the clinic that they have everything they need. And then generally, just as a physical therapist, you're going to have to network with other facilities, other physicians, trying to drum up business, making sure that you have enough referrals to keep your business progressing or even suitable to stay open.
Okay. What qualities do you look for when hiring a person for physical therapy?
For a physical therapist, we need someone that's highly self-motivated because the field itself of having a schedule, having to see all these different patients in a very rigorous time frame, you need to be motivated to kind of come in and do that same process day in and day out. And having the ability to motivate your patients and keep them coming in and keep them motivated for therapy. So we look for someone that's very high energy, someone that has good people skills, and someone that's very reliable.
Okay. Those are the qualities I have. What's the most rewarding aspects of the job?
Anytime you get someone that came to you with an issue and you were able to meet or exceed their expectations. Anytime you get a comment like, this is the least amount of pain that I've had there in 10 years, or I wasn't able to do this for a length of time, that is the most rewarding part, easily.
What changes do you anticipate in the next 10 years in the industry?
I think healthcare as a whole is undergoing a lot of changes. It's hard to say what I would anticipate happening. I think everyone right now in the respective fields is kind of just digging their heels into what they have and trying not to give up any sort of control, trying to put like a little fence around their own yard to make sure that no other fields start to take anything that's specific to their field, so that we can continue to communicate to insurances that this is why this field is important, right?
What possible things could they take?
Well, like athletic trainers, for one, are trying to move more towards the field of becoming primary care providers. So getting out of their typical sort of athletic areas. You see this a lot with physical therapists and chiropractors, where chiropractors will phrase that they're doing physical therapy, which they're not allowed to do.
Who is working in a chiropractic office and they call it physical therapy, so I understand that.
Yeah, so unless there's like a PT on staff, they can't do that. But even like in PT, like we've started to do acupuncture, we just don't call it acupuncture, and so everyone's just kind of trying to expand their own field,
make themselves more valuable.
Exactly.
How does your personal philosophy affect your professional practice, and if so, in what way?
Well, I think I've kind of adopted my personal philosophy from my practice. It's a very service-based industry, and so every day trying to go into the clinic, if you're seeing patients with a servant's heart, and understanding that it's not about you in that moment, you need to leave all your other stuff outside the clinic. So if you're having a bad day, you can't pass it down to your patients. If they're having a bad day, you need to try and be empathetic. You need to try and be understanding. You need to try and understand that you're there for them. And so that's been really good for me as someone who has small kids to take that own sort of philosophy and try and carry it over to
5-year-olds.
Taking it into home and understanding that you need to be empathetic with your kids and understanding it and those same sort of grace-filled qualities.
What should I prepare for now in regard to the career?
So if you're thinking about going to physical therapy, by your junior year, you need to be looking at PT schools and understanding the differences in the academic requirements.
I have been doing, I actually talked to you about that before. And I've been looking at 2 schools I want to apply for.
Okay, perfect. So then getting all of that down and then trying to make yourself as a candidate stand out in some way, shape, or form. So
Yeah.
making sure your GPA is as high as it can be, making sure that you're getting any sort of observation hours that you need.
Yeah.
The hardest part for students in the traditional undergraduate setting that are like 18 to 22
Mm-hmm.
is I always give them advice that they need to try and look 10 or 15 years down the line,
Yeah.
as hard as that is, and see what they want their life to look like and then begin working for that.
Exactly.
Not just, oh, I'm going to be a physical therapist and not think past that.
Yeah.
It's very difficult for people in that age because they're undergoing so many other transformative things.
Oh yeah. I'm kind of happy I went in a little later because I was more mature going into school than I would have been if I went when I was 18.
Mhm.
So I think that was actually really helpful to me because I have more. I'm a mom and I have more of. I have to provide for a child. I have to do this, and I don't have to just think about me
Right.
and what I want to do right now.
Yeah.
So
It helps to
Yeah.
already almost have other priorities established
yeah.
versus, oh, I'm fresh out of mom and dad's house. I have no
Yeah,
responsibility.
exactly.
I just need to go to class and make decent grades.
Yeah.
The more responsibility you have, the easier it becomes to look down the line
Yeah.
and prepare for those things.
Exactly. All right, those were my 8 questions.
Okay.
On the mock interview, if I was looking to be hired as a physical therapist, what 2 questions would you ask me? And please allow me to answer them.
Okay.
And I have my resume and cover letter.
Okay.
Unfortunately, I accidentally printed out my original one and not
That's all right.
the stuff I added to it later, so I apologize for that.
That's right.
And yeah.
Okay. So one of the questions that I love asking people in interviews is tell me about your least favorite boss and why.
I actually have it. Oh man, I have 2. I was married at one point in time, and my husband owned a restaurant, and he was my boss, and that would probably be my least favorite
Okay.
because it affected the marriage.
Okay.
And we're not married anymore, so
Okay.
so that would probably be my least favorite boss.
Okay.
The whole leaving personal matters at home and not at workplace
Okay.
became hard at that point in time because, you know, you're working with the person who is in your personal life.
Yeah.
And so I definitely would never work with a significant
Okay.
other ever again.
Well, we don't have to worry about that in my clinic. So, who was your least favorite boss from a working relationship?
I worked at the Lucky Greek when I was 19 years old, and my boss happened to also be in the Greek mafia.
Okay.
He was very sporadic. He hired very sketchy people to work with us, and I ended up losing the job because he didn't communicate schedules, and even if he had changed it without my knowledge after I had already called in for the week to get my schedule, he would punish me for it. And I was under the impression that I only had to call once a week to get my schedule, and if any changes happened, they should call me.
Okay.
And that didn't happen, and he was very unprofessional, sorry, about the way he went about those things. And so that would probably be my least favorite job. I've only had 3.
Okay.
So.
That's fair. So you've probably dealt with conflict in various areas,
Yeah.
and we see this sometimes like in schooling when you have like a classmate that's not pulling their weight or something.
Yeah.
What motivational tactics would you use, or have you used, like with a classmate that's not pulling their weight, that you think you could carry over to maybe a patient that's unmotivated or maybe not willing to do exactly the way you instruct, tries to dictate the treatment?
I would possibly try to explain to them the repercussions if they did not carry through and pull their weight. For a classmate, we can get a bad grade, which will ultimately affect their grade in class and possibly either a job you would get after, or if you wanted to get into graduate school, it could affect you getting into that school.
Yeah.
A lot of people don't think about those things, and so I think as far as a patient would go, explaining to them, if you don't do this, you won't get to the end result you want. And it's important to keep at it, and as frustrating as it may be, to get the goal that you want.
Good. Good answers. Is that it?
I believe so.
All right.
I don't know if you want to know the things that I left out, because currently I know that it's important to do like public service, and my job right now is currently Meals on Wheels for senior citizens.
Okay.
And so I know that
Very cool.
can carry some weight.
Awesome. So your GPA is 3.5?
No, she wanted me to put it to where I would like to be when I graduate.
Okay.
And so I'm trying to get it there, but
Okay.
I'll be honest, I don't know what it is right this second.
Okay.
But it's not a 3.5 right now, I'll be honest.
So with PT schools, they split it.
Mhm.
They give you 2 different GPAs. So they want to know your overall GPA,
Mhm.
and then they want to know your GPA just in your science classes.
Okay.
Generally, their minimum qualification will be a 3.0 GPA overall,
Okay.
but they'll want a 3.5 in your science classes.
Okay, yeah. I have noticed that with the science classes, I'll admit anatomy 1
Mhm.
kind of hurt me a little bit, and I do intend on retaking that one. But overall, I obviously am more interested in those classes than
Yeah.
I was in, say, math.
Right, or
I did
general
not like
English or
that.
something like
Yeah.
that. Yeah.
I actually did really good in English, but so I'm hoping to have a higher GPA in those classes,
Yeah.
because even this class I'm currently taking is way more interesting than any of my other classes.
Yeah. Good.
Yeah.
Awesome.
All right. Well, thank you very much for your time.
You're very welcome.
And I don't know if this is even still recording. Oh man, don't tell me it stopped recording. I think. What are you doing to me? Oh, okay.